Good afternoon, everybody. My name is Lisa Green. I'm from the Western New York Rural Area Health Education Center. Welcome to our opioid overdose reversal training with Dawn Stone of Spectrum. I'm going to wait just a minute to see if some other people jump on. We do have about 14 participants now, and we actually registered about 37, so I will wait just for a few more minutes. It would be really helpful if you're able to have your video showing. It's nice for Dawn to be able to see people's faces. Unfortunately, Dawn is having some technical issues herself and cannot have her video showing, which she's disappointed in, but it's just a technical glitch that she cannot control. Okay.
Hello, and I'm Dawn from Spectrum Human Services. I recognize a few faces. And if you could mute yourselves so that we don't get some background noise maybe in the middle of the training, that would be wonderful. And we will have a question and answer period at the end. We really appreciate you joining us for this Zoom Narcan training.
Okay, I apologize. I need to share that screen again. Are you ready for me to show that video, Dawn?
Yep, if there's nobody else in the waiting room and everybody's here, that would be great. We have a couple different videos. This one talks about stigma and the uses of Narcan.
Okay, I just admitted a few more people.
Yes.
So, again, welcome to the opioid overdose reversal training. If you could mute yourselves and put your video on if you're able, so Dawn can see who she is talking with this afternoon. And again, if you weren't here a few minutes ago, Dawn's having some technical issues herself and can't show her video, which she's disappointed in, but that is the way it goes. So give me a moment, I will share.
All right. Hello. All right, switching.
Okay, and Dawn, if you want to introduce yourself again to those who just came on, I need to search for that video. It closed out on me.
Okay. Hi, I'm Dawn Stone. I'm a peer at Wyoming County Health and Human Services at Spectrum. And we're going to do a short but very informative Narcan training. We have a couple very good videos that we watch. I do see quite a few people unmuted. So if you don't know how to mute, you just hit your little microphone and make it turn red. Because I do hear some background noise, whether it's somebody's television or somebody else in the room. That way we won't get a lot of background noise. Does anybody have any questions of how to mute? Yeah, that sounds better. Okay, so Lisa is going to pull up our first video, and it's going to talk about stigma and just why it is that we choose to use Narcan.
Okay, can you hear that, Dawn?
Yes.
Today I want to talk about Narcan. Narcan is an opioid reversing drug. So it has the capability to save the life of somebody who is experiencing an overdose on opioids of any type, be that prescription or non-prescription. Okay, so why do we need Narcan, right? That's the question. It's an opioid reversing drug. So 130 people die a day from opioid-related deaths in the U.S. That equates to 47,600 people a year losing their life to opioid fatalities. Here's a chart just detailing the number of deaths involving any opioid by year, right? So we start in 1999, it's really low, and it goes up and up and up, and this data ends in 2017. This chart just shows us that there's different types of opioids, right? So you have commonly prescribed opioids, your Vicodin, your morphine, etc. You have heroin, which is generally purchased on the street, and then you have other synthetic opioids, most notably fentanyl. This is Katie. She lives in Western New York. She is a mother, a worker, a volunteer. She goes to grad school for wildlife conservation. And she was revived by Narcan 17 years ago. Narcan matters because it saved Katie's life. There is sometimes controversy around harm reduction tactics when we're talking about stigmatized subjects within society. So anything that could be considered taboo, like drug use or sex. Harm reduction focuses on reducing the harm associated with a specific behavior. And I can assure you that each of you have practiced harm reduction today. Both wearing a cloth mask and wearing your seatbelt are examples of harm reduction. So a cloth mask seeks to mediate the risks of going out in public during a global pandemic. And a seatbelt seeks to mediate the risks associated with driving, because driving is an inherently dangerous behavior. The goal of Narcan is to help people stay alive long enough to live beautiful lives. This is pretty much the same goal as masks and seatbelts. But still, the internet can be a scary place and a harsh place, right? And I oftentimes see things there that question the use of Narcan or question the worth of the lives that Narcan saves. It's interesting because I never hear those same sort of conversations around people who have had heart attacks and need to be revived. And the truth is that stigma impacts the kind of help that people get and also how society sees them. Which I can say as a person who is in recovery, when I was in active use, I didn't feel real good about myself. Katie's life is worth it. And it could have been you. It very well could be you who is in a situation where Narcan is needed.
Okay. So I really like that video. And again, thank you for joining us to learn how to use Narcan. And I wish my camera was on because I have a kit right here with me that shows you exactly what comes in a Narcan kit, but we're going to go over it. And then we also have a video that will show you exactly how to use a Narcan kit. So I'm going to start going over the essential topics of what Narcan, or the medical name for it is naloxone. What does it do? It reverses overdoses due to opioids. As Aaron in the video said, some of those are prescription opioids. Some are heroin that comes off the street. There's Oxycontin, Percocet, Vicodin, methadone, and of course, fentanyl. It will not cause harm if it is not an opioid overdose. So if you administer Narcan to someone and say they were having a heart attack or they were overdosing on alcohol, that's not going to hurt them. How do you recognize an overdose? So I know we have a lot of first responders with us, and it looks like a lot of other things when people are unconscious. but there's also shallow or no breathing. Breathing can be noisy, snoring, gurgling, turning blue. Person is not responsive to a sternal rub or yelling, hey, hey, are you okay? So if they're not responding at all, they're turning blue. You don't know of any evidence that it could be something else. Giving Narcan at that point gives them a good chance of coming out of an overdose. And it could be an elderly person. It does not have to be a young person. Elderly people take a lot of different medications. And if they by accident took too many of their pain medications, it could be them. So what do you do in case of an overdose? You call 911 first because you want first responders there. So we have a video to watch that shows what to do when you come upon someone that could be a case of an overdose.
For a known or suspected opioid overdose, the appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children.
Okay, so that was a lot to take in a short time. With the Narcan nasal spray, it does give a lot of symptoms that sound similar to a heart attack. But as it also lets you know, it does not cause a heart attack, and it cannot worsen, the heart attack if a person is already experiencing one. The naloxone can only block heroin or opioids for 30 to 90 minutes, reversing an overdose and causing withdrawal, after which the heroin or opioid comes back. If you administer the Narcan once and no response, you give the second dose within 2 to 5 minutes. So every kit comes with 2 small doses. You never pre-spray to try it out. You always give the full dose right into the nostril. And you always tip the person's head back. You can also do rescue breathing if it doesn't seem to be working. Go ahead and give a few rescue breaths and see if they go in, and make sure, as always, that you have called 911. If you do have to leave the person alone to get to a phone, which is unusual nowadays, but can still happen, place them in the recovery position on their side with their arm extended. So, did anybody have questions at this point? I do like too that when you open the container and pull it out, there are directions right there. If somebody's nervous, they can always check back to make sure the person is positioned right. Just like with CPR, a lot of times you have to reposition the head and the neck and make sure that the air can get into the person and the Narcan can go into the nostril fully. So if the person does wake up, explain what happened, advise against using drugs, right? Any more drugs right now, and really work hard to get them to talk to EMS or go to the ER. They will not get in trouble if they go to the ER, but they will be watched. And I do know I had a current, my cousin's boy passed away because they used Narcan and then left him alone for the night. And what happens is it stops working after 30 to 90 minutes. And it's not that he did more drugs, it's that the drugs that he already had in his system took effect again. He re-overdosed and he did not wake up. So if they're not seeking medical care, if you cannot get them to stay and talk to EMS or go to the hospital, make sure someone is staying with the person for at least an hour and a half, really 3 hours is the optimal, to watch for a return of an overdose. It is legal to carry and use Narcan in New York State if properly trained and prescribed. So we're going to send you each a kit. If you use it, you can go to your local pharmacy and they will give you a new kit, or you can go to your local health department. Not all pharmacies will cover them. Usually there's like one within a city or an area. I know in Wyoming County, it's Sinclair Pharmacy. They will give you the kit and they might ask you if they could charge your insurance, but there'll never be a copay on it. So if you do use your kit, it is there is a form with it for you to send into your local health department, so we keep track of how many people have been Narcaned in our area or in your area. There is a 2-year expiration date on every Narcan kit, and it will be listed on there. It used to be 1 year, and now they have extended it to 2 years. Narcan needs to be stored at room temperature. You can have it somewhat above or below, but you can't keep it in your car on super hot days. You can't keep it in your car during the winter time. So hopefully you have some way to carry it with you. So there are different risk factors for people to have overdose. Some people become incarcerated, go in the hospital, go through rehab, and they become sober. And then they decide, well, I'm not ready. And they have a relapse and they try to use the same amount of drugs that they used before. And that puts them at a high risk of overdosing. The other reason is fentanyl is added to whatever drugs they choose to use, whether it be off the streets. Usually it's off the streets when there's fentanyl in there. I do have a tape on fentanyl, but I don't think Lisa has it for first responders. And one thing that I always try to talk about, if you come upon a scene and you believe there's suspected fentanyl on the scene, make sure you wash your hands with soap and water. If you get something on your hands because you didn't have gloves on at the beginning, do not use hand sanitizer. It will help the drug to actually soak into your skin. So you'd never want to use hand sanitizer if there's suspected fentanyl or heroin, as it will actually help it go into your system faster. So there is a Good Samaritan law about if someone's experiencing a life-threatening emergency, the person who is calling will not be charged or prosecuted for a drug or alcohol-related offense, including possession of drug paraphernalia, with some exceptions. It does not protect people if they're on parole, probation, or have any CPS issues if there's children on the scene. I think we've went over pretty much everything. As I said before in the kit, not only is there directions, there's also emergency breathing mask, a rescue breathing mask, so that you can put it on the person's mouth before doing CPR, a face shield. And Lisa, was there anything you wanted to add?
So Dawn, there were a couple of people who came on late, and I
Okay.
wondered if you'd be willing to just go over the basics of how to access the kit, how to use the Narcan when you come upon a situation, just to not only go over, but to inform those people who just came on.
Okay, sure. So we're going to send everybody a kit, and in your kit, there is directions to read over and a rescue breathing face barrier to do some rescue breaths. And there's 2 nasal sprays to use. So when you use the first nasal spray, you want to make sure you don't spray it before you put it in the person's nostril. You get them positioned on the ground, flat on their back. Make sure their head is positioned so that you can insert it into one nostril and do a full spray. They should react within 2 to 5 minutes if they're in an overdose. If they don't come around and you're fairly certain it's an overdose, then you go ahead and give the second dose. And if they do wake up, sometimes they'll actually be a little angry, going, what's going on? They'll be confused. Just let them know that they were overdosing and that you have brought them around, and that 911 hopefully has already been called and is on the way. And really recommend they go to the emergency room, as they could re-overdose within 30 to 90 minutes. The way the Narcan works is if the drugs are still in their system, if they have enough fentanyl or heroin or any type of opiate in their system, it can re-put them into an overdose. And you want to make sure that that doesn't happen after you leave them. So they should be with somebody for at least an hour and a half, but up to 3 hours is the optimal. And you won't get in trouble, nor will it hurt someone if you use Narcan and that is not their problem. If they're having a heart attack, they're unconscious for some other reason that you cannot see or that you don't know about, it's not going to hurt them physically. And there's no repercussions. You used it in good faith to try to bring them out of a situation you thought that you believe that they could be in.
So Dawn, you shared with me some good news before we got on with others. Can you share that with them?
Sure. So I actually, one of the community people that I trained used Narcan about 2 months ago and saved a life. And they're very proud of that. They were very scared when it happened, but they said they didn't need the directions. It came right back to them on how to use it. And the person that they saved is actually in recovery and hopefully will do well at staying sober now. So there's always the good side. The bad side is some people continue to use even after using Narcan on them, or the hard side to hear. But that doesn't mean the next time, or they'll never overdose again and they'll get sober, or the next time will be their time to say, hey, I'm ready to do the hard work of getting sober.
Oh, that's always been an encouragement to me, not only that we can actually save a life in a very easy way, but that Narcan will not harm someone if it happens to not be an opioid overdose. administering the Narcan won't harm them. And that's always been a comfort to me as just a civilian who is not real comfortable with medical procedures. Knowing that you really can't mess it up is really comforting to me. Did anyone have any comments or questions? I did have a comment in the chat. While you're thinking of maybe something you'd like to ask, let me ask this. John said, did you say our insurance will get charged if we need a refill of Narcan? Does it matter if we only used it to administer it to someone else? Shouldn't the health department pay for it in that instance? Do you know anything about that, Dawn?
So if you get it from the health department, that's always from a grant. So your insurance will not get charged if you pick a new kit up from your health department. If you go to a pharmacy and ask for a new kit, with some insurances will be charged. It's a minimal fee. And sometimes they don't charge it all if the pharmacist had gotten a grant to have Narcan kits on hand.
Okay, thank you.
Thank you.
Go ahead.
Oh, just saying thank you. That's it. Thank you.
Hey, you're welcome.
Were there any other comments or questions? Feel free to put them in the chat or just jump right in.
The possibility of, like, you know, if somebody does wake up after we administer it, that they might start to vomit, that sort of thing, like sure to have them on their side, and you know, like if they come out of it, what can that look like?
They can get sick. Usually, actually, they just sit up and they probably feel okay. They feel better than they did as long as they start getting the deep breaths in. Although if they've also drank alcohol or used another substance besides the opiate, there's a chance that they're still going to act, you know, high or out of it.
And that is why we do use the recovery position, right, Dawn? So
Yes.
that if by chance they did have an episode of vomiting, they weren't going to choke on it.
Yep. And usually they just kind of wake up and they're confused, like what happened, and they don't really understand what happened. So the one person that I know of personally that was saved, just, yeah, he sat right up and said, where am I? And, you know, just was not sick at all from the effects of it.
Okay, thank you.
You're welcome. Well, thank you all for attending. Anytime that we can get the information out there, we're very, very excited here in Wyoming County. We've lost a lot of young people, especially to overdose. And I know sometimes with stigma, people think, why save them? But they might be the ones that get a hold of a peer the next day and they find a better pathway to getting recovered from using opiates. Or it could be someone that we know because they started on a prescription for pain and they got addicted. It happens very quickly. People don't realize how quickly they can become addicted. One of the young people I was just working with started with a pain prescription from his doctor. And so if we think of that, even if it's someone that we're not sure, you know, hey, are they really going to get sober? You gave them another chance to at least try and get their life back on track. And there's more and more help available, which is just amazing here in Wyoming County, where we're smaller in all of our counties, to help people get sober. So thank you for attending our training. And I'm
Was there
smiling.
any other
No, my
questions
camera's
at
not
all?
on.
Oh, I know. I'm so sorry, Dawn, that you were unable to show your beautiful face. But we so appreciate you coming and giving the training today. Were there any last questions for us? I will be sending out certificates and also information, kind of a summary of what Dawn has talked about. I will be sending that out via email. There were some folks that I know could not get on for some reason. didn't find the link in their email. So if you are someone who jumped on late, you know, we will be having other trainings at later dates. We would love if this has been helpful to you, please pass the word on that that Dawn does do these trainings, and they're brief and they're so important to our community. It is encouraging to know that the interest in Narcan training has just boomed. Don't you think, Dawn? It's just
Yes,
multiplied so much.
yes.
So I hope everyone has a wonderful rest of the day. And we have a couple of things in the chat, so you're very welcome. Have a great day, everyone.